So now I'm so old now that many, many things have come true. And so now at what could be the tail end of my career, I'm being viewed with, wow, you knew this 30 years ago. And so
Mm-hmm.
I've gone from being capital C crazy to lowercase c crazy cool.
What if heart attacks weren't a surprise or even could be prevented altogether? Today, I'm talking with Dr. Jeffrey Boone, a preventive cardiologist who chose medicine with a crazy idea and has turned it into a life-changing reality. We unpack why waiting for symptoms fails patients, how elite athletes can still carry hidden cardiovascular disease, and what heart disease prevention could mean for the future of healthcare. Welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. Dr. Boone, thank you so much for joining us on Shadow Me Next today. Absolutely incredible what you are doing in preventive cardiology. Cannot wait to discuss it with you. Thanks for being here.
Thank you very much. Great to be here.
So let's start at the beginning. Dr. Boone, you are a cardiologist, have been doing this for a number of years. Has your practice in cardiology looked the same since you started working, or has it shifted over the last number of years?
Yes, I have a kind of a unique approach to this. I'm actually completely a preventive cardiologist, which really doesn't exist. It's really a cornerstone of medicine that has been far underutilized.
Mm-hmm.
The typical board certified cardiologist is really learning procedures like how to manage emergency rooms and cath labs and angiograms and pacemakers, and stents. And that's a whole different skill set than I have. So I actually went to medical school for the only reason that I went in the 70s was to prevent heart disease.
Mm.
Well, everyone sort of thought I was crazy because they were just now learning how to help fix heart disease, which I thought that's fabulous, takes a lot of skill. So I would say in the world of cardiology, which I'm not the usual typical cardiologist, I've been pursuing for, getting close to half a century, the prevention of heart disease. Now, when I first started, even doctors of all levels were not talking about lifestyle at all. And in
Mm.
the 70s, there were no good medicines to use that were actually comfortable to take to prevent these diseases. So I sort of went in it initially to be a voice because I saw how powerful the degree of MD is, that rather than being someone who counsels for hours and hours about diet and nutrition and exercise, which is very important, but there are many people that had those skills already. I thought just having the voice of an MD would empower them. And so that is how my career began to develop. And my wife, before we were married, was the first one that kind of suggested that I should go to med school because I was dreaming and talking about our futures. And she eventually became a lawyer, me a doctor, but neither one of us was doing much of anything rather than just surviving at basic jobs at that point. I'd already gotten a master's in exercise physiology, so I was
Mm.
always working in exercise facilities. In those days, there were no health clubs, there was no Lifetime or Planet Fitness. There were just big
Mm-hmm.
YMCA buildings in downtown major cities of America. And those were sort of the focal point of fitness, basketball, racquetball, squash, things like that. So that's where I worked and began pioneering in the mid 70s, exercise being a medical tool actually to evaluate your heart.
Mm-hmm.
And then Paul Dudley White had made Dwight Eisenhower exercise after his heart attack. And that was very revolutionary. People used to
Mm.
think you should lie still after a heart attack. And so the YMCA became a focus of post MI, post cardiac event rehab. And I was the exercise person that led the rehab in a place of Des Moines, Iowa. And that's where I met my wife. So I was thinking about getting a PhD in exercise physiology, but I met at the time a guy named Ken Cooper who pioneered aerobics and was sort of the father of jogging almost. And I got to meet him and he said, PhD in exercise physiology would be great. And this was even before the Los Angeles Olympics long, long ago.
Mm.
Um, he said, if you can be an MD, you'll just have more power, flexibility. You won't
Hmm.
have to ask anybody's permission to do much. And so I said, okay, where do I sign up? Because I'd never even thought of being a doctor. I was like 27, and my wife had first suggested it. And I thought you could just go down and sign up, and where do I start? And I found out that if I interviewed, nobody was interested in my ideas about preventive cardiology.
Mm,
But fortunately, the University of Iowa didn't interview. So they didn't know that I wanted to prevent heart disease. And so I got into Iowa. It was a miraculous entry, but my whole medical school career, I was one of the few doctors that knew exactly what I wanted to do. Most of the time, you're
right.
getting education, whether it's in physician assistant school or medical school, whatever, you're sort of learning the language of the profession. And then you decide whether you want to go into eyes or skin or heart or bowels or whatever you want to go into. But I knew right off what I wanted. So every course, whether it be histology, biochemistry, nephrology, I would always look at what are the preventive aspects of it? What could exercise and nutrition do? Um, and so that continued through that process. Got an internal medicine residency and really totally focused
Mm,
on preventive cardiology, which still didn't really exist. And then uh, the program I was in now in Portland, Oregon, Nike had just invented jogging shoes. It was just getting started. And so Portland was a good athletic running type of a city. And so all the doctors there were very fatherly to my interests. And so even during my residency, I was the head of cardiac rehab and I would do, articles and write papers on exercise and the dialysis patients. So I was fortunately in a lot of places that sort of fostered my interests. I never really actually did interventional cardiology or the typical cardiology track because it was really teaching me everything that I wanted to prevent. We got
mm,
plenty of guys that can do stents and take care of ERs. And
hmm
so I sort of pioneered this profession that didn't exist, asymptomatic preventive cardiology.
hmm
So that's a bit
hmm
of the background of how I got into this. And unfortunately, just continued to try to pursue the dream with really no jobs really focused on that. From healthcare systems to insurance companies, nobody was interested in prevention. They thought they were, and they would advertise that they were, but they really weren't at the very highest level. And then the imaging of the heart, the imaging of plaque,
mm,
and the medications, just every 2 or 3 years over the last 40 years, just incredible array of medicines that have moved cardiology now mainly into primary care. Like, as I think the actual disease of heart disease is every specialty is involved.
hmm
And
hmm
that's where a physician assistant, nurse practitioner, family physician, internist should actually be leading the charge. And cardiologists are only there for our failures,
mm,
meaning that if we aggressively redefine significant and aggressive, we've tended to think of significant disease as one that's involved with chest pain or severe blockages. But actually, in our case, any detection of plaque, atherosclerosis, in our world at the Boone Heart Institute is viewed as the detection of cancer. And
hmm
obviously, you don't tell anyone, well, you've got just a little bit of cancer, so let's wait until it gets really big and then we'll take care of it. But that's what we do in heart disease. Number one, we
Wow.
don't measure heart disease. And number two, we don't treat it aggressively until it's symptomatic.
Oh my gosh. So many mind blowing things that you just mentioned right there. Absolutely incredible. I want to dive into three. There were three things that you mentioned, and I want to make sure that we really push into a couple of these. First being I am just infatuated with the idea that you sought medicine really as more of a platform so that
Mhm.
you could do
That's
what
right.
you needed to do. I think a lot of people go into medicine hoping medicine will tell them what they should be doing with their life, right? For you, you knew what you needed and you knew that medicine would give you that ability. And becoming an MD, that was going to be the road for you. Being a pioneer is very difficult when your ideas are going against the grain or perhaps a little unique. Were you ever discouraged? Did you ever think, well, maybe I have the wrong idea in all of this? Maybe this is silly. Maybe I'm thinking incorrectly, not just differently. And how did you move past that?
Very good question. And you put it very well. I've never thought of that before, but I used medicine as a platform to get where I wanted to go as
Mhm.
opposed to the reverse. Um, So interesting. Yeah. And so always everybody was kind of intrigued with what I was doing, but there
Mhm.
were a lot of naysayers. Oh,
Mhm.
exercise is going to help. Who cares if you lower cholesterol? It was pretty easy to be a decade ahead of whatever was going on with like at the University of Iowa, where I was in med school, they were just beginning to invent CT scans. And an interesting fact is the first inventor of the CT scan was a guy named Geoffrey Hounsfield from London, and he was funded by the extra money that the Beatles were making in the music world. They were looking for something to invest
Oh,
in, and so they invested in Hounsfield. He developed the CT scan, and now I'm at the University of Iowa, and it was still at the end of the time when you would do exploratory surgery to find out about
oh,
something. And now you turn it on a CAT scan and you know exactly what's going on. So I was there with
wow.
just the beginning of CT scans. So that was kind of amazing. But everybody at the med school, I'd say, I I'm going to try to prevent heart disease. And
Hmm.
they all thought it was kind of interesting. And then I was pretty good at just being focused and
Yeah.
being passionate about it. And so it was hard to talk that down. But then another thing that's developed in our work at the Boone Heart Institute, one of our core corporate values is called humble confidence,
Mm.
meaning that I would always double check, as you say, my theories, my thoughts, what could be possible, and really listen to naysayers or critics and never really got discouraged, but would always reassess the data.
This is a great time to pause for Quality Questions, a segment on the show where we talk about a question that you might hear on your own pre-health interview. So what Dr. Boone is talking about here is basically this quality question. What problem do I feel responsible for solving, even if no one else is focused on it yet? So many students enter healthcare hoping the profession will tell them who to become. Dr. Boone did the opposite. He chose medicine because it gave him the authority and reach to solve a problem he already cared deeply about. If healthcare were just a tool, not the goal, how would you use it to build or change a problem? And it doesn't just stop at quality questions. There are more resources for you as a pre-health student on shadowmenext.com to include our newly released application readiness course. So head on over to courses.shadowmenext.com and check it out.
And I would often say, no, they're wrong. I think we could prevent this disease. And then as every new drug began to develop, oh my gosh, now we've got a safety net. So I always kind of figured your lifestyle is a bit like a trapeze act. And
Mm,
you want to get very good at the trapeze. When you fall off, though, you ought to land on a safety net. And we had
mm,
very few safety nets. And that's where the medicines come in. I'm happy if you lose weight, but let's get you on a diabetic medicine while you're losing weight, or I'm happy
mhm,
that you're
mhm.
exercising to lower your cholesterol, but let's get on a cholesterol medicine to be a safety net if you fail, because every meal is a new challenge. And so that humble confidence, I think, got me through the next 4 decades of, and then as I got older and older, more of the things that I had been sort of pioneering in thought in my lectures and other things began to come true.
Mhm.
So now I'm so old now that many things have come true. And so now, at what could be the tail end of my career, I'm being viewed with, wow, you knew this 30 years ago. And so
Mhm.
I've gone from being capital C crazy to lowercase c crazy cool. Because
Love
a
that.
lot of even world leaders are saying, my gosh, he's been doing this for 30 years and we've just now proven he was right. And, so very humbly, though, not to say I told you so. And then if I'm worth my salt, what we're doing today should be 10 years ahead of what's happening even now.
Mhm,
Uh,
mhm.
that's sort of how I weathered the discussions, the criticisms over the year. But it's usually pretty logical. The other thing I did is in law, you're sort of innocent until proven guilty.
Mhm, mhm.
But in medicine, we make things guilty until we prove them innocent. So it
True.
takes 30 years to prove that exercise is good for you, or 30 years to prove that smoking is bad for you, when you could ask any 10-year-old and they could have told you the answer, but it took decades for the statistics to actually prove those things.
It does seem a bit backwards, and I'm sure your wife, who is a lawyer, would probably giggles at us and thinks, medicine is quite reverse a lot of times. I love the humble confidence that you've described, but as also like the fact that you said you listen to the naysayers. I think a lot of people say, well, tune them out, don't listen to them, ignore them, ignore them. But really, if we listen to them with humble confidence, like you said, it's not a discouraging thing. It's really, it's a push to investigate further, right? Okay, well,
Yes.
perhaps they're right. That's fantastic. And I'm so glad that you pushed through and really have pioneered this whole field. Medicine has advanced. We've talked about the medicines that are available now, the GLP-1s, all of that. It's incredible what medicine has done, and you've seen the lifestyle movement really advance as well, right? I mean, gosh,
Yes.
anywhere from like the post in my YMCA to the invention of jogging shoes. I mean, you've seen major advances. Are we in a good place right now in preventive cardiology? Have we arrived? Is there more to do?
I think we've arrived. My goal when I started my career, and then my family, my sons are the CEO, the president, lawyer, director of our company. And I remember a couple of years ago, as I was getting older, and we really had very few doctors that were working with us at that time, and they were thinking, darn, your dream is not going to come true, because my dream is to eradicate heart attacks. I mean,
Right.
literally, and that's possible. And then about 4 years ago, we discovered that yes, we can do that, but you've got to do exactly what Boone Hart tells you to do, which
Mm-hmm.
anybody could do. And that really empowered me that now the next step is not only to do it with our patients, which is pretty easy to stop the biggest disease in the history of the world, but how do you get it now to everybody of every socioeconomic class? And you're
Wow.
right, we now have, so to kind of further answer your question, we got now several doctors. We've even got, we're hiring our ninth provider here just this week. Used to be just me like 4 or 5 years ago, but everybody
Wow.
is seeing the possibilities and how
Mhm.
free we are. We're unencumbered by insurance or
Mm,
universities or others, but then there's a big trust factor.
mm,
Like, unless you can trust me, you should just listen to what they're doing in the regular medical world, which is pretty much pedestrian, I think.
mm, mhm.
The approaches are often there. And then what's happened is at the last meeting of the American Heart Association in New Orleans just 3 months ago, the whole convention just switched to becoming preventive cardiology because
Wow.
now we have at least 12 medicines beyond statins. Hardly any of them have any side effects that just do incredible things that literally half of America ought to be on.
Mm,
And then we have incredible imaging. Now, the big problem with I've always thought, even back in the 80s, how can you treat a disease if you don't measure it?
mhm, mhm,
Like, you got to look at the skin and see what's going on.
mhm,
You've got to examine, you've got to find the disease. And so almost every disease, including breast cancer and colon cancer, we do strategies to image the disease. But the biggest disease that kills the most people in the world for the last 100 years, we don't image.
mm,
We look at risk factors, and cholesterol is not the disease. Blood pressure is not the disease. Blood sugar is not the disease. They're numbers that predict the disease. But we've always been kind of pioneering how can you actually image the disease? And
mhm.
that means you got to look inside the arteries. And so, beginning with those CAT scans with Hounsfield, who invented CT, there was a score in 1986 was developed, something called the coronary calcium score, and it measured a part of the plaque. So that now in our world is a pretty pedestrian test,
Mhm.
but it measures calcium. And then the other thing, just as a sidebar, I've got a 43-year-old friend that was talking to my daughter-in-law, and she had a mammogram at 43, and they discovered no breast cancer, but they discovered calcium in the mammary artery, which is a simple heart scan. If you have
Mhm.
calcium in the mammary artery, you've got atherosclerosis, you've got heart disease. So if we could get the red ribbon and the pink dress programs together, you could save 10 times more lives with mammograms if you just looked at the
Wow.
calcium in the mammary artery. So there's a lot of little correlations that would empower people. The same thing in dentistry. If you see
Mhm.
calcium in some of the images they take of your teeth, you've got the disease that will kill you. Half of
Wow.
America is going to, well, all of America will die of atherosclerosis at some point. Half of them, something else will get them first, you know? And so It is the disease, and it doesn't hurt, and you look great in your coffin when you die young.
There you go.
You know, like that.
Yes.
And then as I get older, 80's not old,
Mm-mm.
90's not old if you're 90. And I think you can prevent all those things. So imaging, very important. Now, calcium score, quick scan of the heart, you can go down and get those for cash for $100 now. But
Wow.
then most people aren't empowered to do anything. If you've got calcium in any artery, you need to treat atherosclerosis. You've got cancer at that point, in my mind,
Mm.
metastatic atherosclerosis, and it needs to be treated aggressively. And aggressive might just be vitamins, risk factor control, GLP-1s, PCSK9s, statins, aspirin, all kinds of vitamins, omega-3 fish oils. I mean, there's dozens of therapies that will stop the process, halt the process, and we now know even reverse the process.
It's incredible. I
It
mean,
is amazing.
it is just incredible. And thinking about this in terms of cancer and how, if somebody said you have cancer, but it's just a little bit of cancer, so we'll just wait until it's just, I mean, it makes no sense when you
Yes.
think about it that way. So why should we not apply it to heart disease as well? Um, I think it was very interesting because what we've always operated under, at least, and not in preventive cardiology, is MIs, heart attacks, always felt very like a surprise, right? All of a
Yes.
sudden, you're doing fine, everybody's doing well, and then he just had a heart attack. It was just a surprise. But from what I hear, from what you're telling me, is it doesn't have to be a surprise.
Yes.
If we can not just look at the risk factors, which are helpful, but not really as great as imaging with the is that the CAC, the coronary artery?
Yeah.
Is that
Yeah.
what
The
that is?
CAC
Okay.
is that is good. It's not perfect, but
Mm,
it's good. And it's only good if you take any calcium. Now, in 1993, I started thinking of the idea that any calcium score is the disease.
mm,
And that was when there was a lot of naysayers. And now 30, 40 years later, that's true. If you have any calcium, the plaque as it grows in your arteries will calcify as it tries to heal itself.
mm,
So if you treat any
mm,
calcium like you treat skin cancer,
mhm.
you go after it. You don't wait. Oh, this is looks like a squamous cell, but let's wait until it gets a little bigger. I mean, it's ridiculous the way we've approached it. And a
Mm,
lot of it is, I think, hospitals, cardiologists, all well intended, but all the money is waiting until you are sick.
yeah.
All of the money.
Yeah.
And it is any article, if any doctor, any program tells you that you should wait for symptoms, they are 100% wrong. And that comes out of the humble confidence. It's that everybody's now realizing if you wait for chest pain, you've waited too long and you'll be
Mhm.
lucky to live. Now we have all kinds of incredible things we'll do once you get the chest pain. Oh my gosh, all just brilliant stuff is being done at that
Mm,
point. But that's like throwing a fourth quarter Hail Mary in football.
that's right. That's right.
And
And
you're in Tebow land, and that's a lot of fun when you win. But a lot of times the ball doesn't land in hands, as happens occasionally now during the football playoffs. So
it brings it to a really great question, which is how, I mean, you're working then with patients who you've mentioned it already, who are asymptomatic. That means they're not
yes,
experiencing this chest pain that you're describing. Their legs aren't, they don't have claudication. They're not
yeah.
experiencing anything. They feel generally healthy. How is caring for somebody who doesn't have symptoms different from treating somebody perhaps with symptoms? Are they motivated?
Yes.
Are they less motivated? What's that look like?
It's interesting. A lot of it is around that area. The best
Mm,
way to treat heart disease is when you don't feel at all bad.
mm,
Every part of it should be imaged and aggressively pursued long before you have symptoms. Now, certainly, we have a lot of people that have warning symptoms, but really, there's a guy named Nick Nur Mohammed from London just did
mm.
a study of 5 million heart attacks, and 2.5 million had no idea anything was wrong. And at least half of those 2.5 million, a week earlier, their doctor wouldn't have even done much because about
Mm,
half the people having heart attacks have pretty normal cholesterol. You don't know who to treat until you image.
mhm.
And then when you image, everything falls into line. Your motivation for lifestyle changes might improve, and certainly the safety net of all the various medicines. And we just have incredible medicines. I expect all of my patients to have zero side effects of any medicine.
Wow.
And
Wow.
sometimes it takes 10 or 12 of those
Hmm.
to do the job. And then by 2029, every medicine that I use from GLP-1s to PCSK9s to there'll be a generic form of them. So this
Wow.
doesn't have to be expensive. And then I think what you're doing is so well. I think insurance, hospitals, and most physicians will be the last to adopt all these ideas.
Hmm.
Now, I say that with great pride and adulation of what their skills are,
Hmm.
but it's going to take patience to say, I could never have a heart attack or stroke or dementia. It's funny to me that we don't think we know what causes dementia. It's exactly the same risk factor pool as heart disease.
Yep.
So we think if we clean out the heart, ultimately the heart is just a big pump in the middle of 60,000 miles of blood vessels. And those blood vessels go everywhere. So if you clean out the blood vessels, my patients don't have to be highly educated to understand, oh, I bet you're cleaning out the 30,000 miles of blood vessels that float around our brain. And most of them would think, yeah, those little brain cells sitting along those blood vessels probably get well nourished and may
Hmm.
come back to life. So I think we're on the verge of curing most of dementia. Now,
Oh,
that's on top of a lifestyle and a genetic overlay. Though I tend to look at broad strokes, but it's more like discovering who might not benefit rather than who's going to benefit, because I think everyone will benefit from those approaches. So the preventive cardiology approach. Then, well, at this American Heart meetings, amazingly, it transitioned to where the coolest thing at the meeting, and this is, guys from London, Harvard, Korea that are presenting all the data, you could just sense the audience realizing, oh my gosh, we could prevent it all.
wow.
And they would actually, some of these lectures were getting standing ovations, and some of the lectures were about the medicines that are
Hmm.
unprecedented. And one of the biggest trials was called Vesalius, about a PCSK9 inhibitor, evolocumab or Repatha.
Hmm.
And it was the first big study that proved that you don't have to wait for chest pain to treat with this aggressive plaque reversing and cholesterol controlling medicine. And then I was getting pointed out from the podium of, yeah, Boone over there's been doing this for 20, 30 years. And so that
Yes.
was all of a sudden, I was not just capital C crazy, but lowercase crazy. He's been doing this for a while. And then on the other side, the imaging is unbelievable. I was at Montreal at the world meetings of the Society of Cardiovascular CT. And at the start of the meeting, they now can image the heart way beyond the CAC or the calcium score to
Wow.
actually look inside the blood vessels. And amazingly, it went from the start of that convention where everybody said, "Oh, we could never do this on a whole population." By the 3 days later, at the end of the convention, the whole place was saying, artificial intelligence is going to score this stuff. All we as radiologists and cardiologists have to do is overlook the data and make sure it hasn't made a mistake.
Wow.
But I think the coronary CTA will be like a colonoscopy in 10 years, and
Hmm.
every 40-year-old will get one. And then they'll decide, and it'll cost $300, and insurance will want it. And I think it was all lining up from imaging to treatment. We've got it all. So in my little clinic here, all I got to do is pass the word around and get the whole world to believe us. We had somebody the other day talking to us about starting Boone Heart Rwanda in the middle of Africa
Wow.
because it's
Wow.
and not that we'll do that, but the whole world could do it, and it doesn't take skill. Like I could do this blindfolded and with no shaky hands because I'm not doing surgery
Amazing.
or stents.
Right.
It's a mindset, and if we can transfer that mindset to the population, and then my sons who are trying to figure out how do we get everybody interested, not just for our own little clinic here, but
Hmm.
how do you
Hmm.
change the world? The key might be stories. Like
Hmm.
most of my patients now, I said, what you're buying here is at least one, maybe two more generations of life.
Hmm.
Buying life, because this is the biggest disease in the history of the world. And it's killed more people every year for the last 100 years than anything else. And there's a lot of other health problems. But if you could stop this disease, you could do a lot. And then all of a sudden, the sidebars is most neurodegenerative, carcinogenic,
Mm.
atherosclerotic, cardiovascular, they come from a core of inflammation oxidation. So most of the medicines we use and everything we use is associated with reduced cancer rates.
Hmm.
So I
Hmm.
think accidentally we're going to prevent dementia and heart disease. And then we get back to processed foods and, exercise, the things that I think we can help you live to 90 and kind of create your own blue zone in the middle of your own body, no matter whether you live in Sardinia or, Costa Rica or not. But you're not going to enjoy it unless you're fit, strong, lean,
Right.
eating healthy, and all that. So as my career unfolds, hopefully the end of it will be getting back to lifestyle, which is not enough to overwhelm aging and genetics, but it's going to make you enjoy life more. So I
Mm-hmm.
think it's all coming together, but it's really who is the market, and it's the patient that has to hear it and have to want it. And then you've got to be foolish to think that your insurance company is interested in your health. Your
Yeah,
insurance company is interested in the cost of your health,
that's
which
right.
doesn't make them horrible, but is a whole different game. So you've got to, I tell my patient, you need to look for ways to spend more money on your health.
Mm.
Because if your insurance is covering everything, you're not getting cutting edge stuff.
Ooh, that is a hot take. And you are absolutely right about that. I love
You're
that.
getting cheap stuff. And then that's where I think the double-blind placebo-controlled trial, it can be a crutch for both doctor, hospital, and insurance company because they can always say, well, we need more data.
Mhm.
No, if you show me a study where it's good to have plaque and it's good to have more of it, I don't need 30 years to tell me I should treat it. Now, if I saw three studies, that's where the humble confidence comes in. If I saw three studies, oh, yeah, it's good if you have a lot of plaque in this trial, or it's good that you have a cholesterol of 300. Then I would slow down, but I'm not going to wait for 10 years for them to actually prove it.
Mhm.
Um, Especially if I'm humbly looking and listening to the naysayers. No,
Mhm.
I've never seen a downside from this medicine. Or, but if it's 50-50 up and down and there's 500 side effects, then you don't go for it quickly or aggressively. So it is an exciting possibility nowadays for this to occur.
It's incredible, Dr. Boone. And I think something that we have not mentioned, but is absolutely important to mention is, the person listening might be thinking, well, yeah, most of America really does need what he's describing, right? We all need to eat better. We all need to exercise. We all need to protect our health. But here's the thing, Dr. Boone, is you are coming from a practice that is not just your typical average Joe. You are working with elite athletes across the NFL, the NBA, the MLB. What have you learned about working with these incredibly gifted athletes who are at the epitome of health, really, and yet still, unfortunately, experiencing some of these things that, me who doesn't have a nutritionist and a personal trainer and all of this, um, I'm experiencing it as well.
Yes. Yeah, I think we back in the 90s, I was trying to figure out how do you get America's attention about that? And that's 30
Mm-hmm.
years ago when we really didn't have, a third of the medicines we've got now and all that. And I started working with the Denver Broncos players and coaches, testing them. And then I thought, well, they're young. The players are young, so we're usually looking for odd genetic holes in their heart or cardiomyopathies or
Mm.
arrhythmias to protect the player. Um, so then I started talking to some former players about the idea we could try to develop a preventive cardiology program for NFL alumni.
Mm.
And we were able to do it all with a lot of corporations getting involved, donating medicines, testing. And that was in the 90s. And the main reason I was doing is that all the people in America, what do they love? The NFL.
Yeah.
And if all those guys, it was in the time when the beer commercials were the Miller Lite All Stars. And so they
Yes.
were all advertising beer so I thought, could we develop like the Lipitor Light All Stars where, all these famous players are telling their people to go get on Lipitor, because that was the big hot drug at the time. And that never panned out, but it was really designing not only to help them,
Mhm.
but them as an example for that. And that continues to mature. So now a company called HeartFlow, for example, which is one of the artificial intelligence companies that interprets cardiac CT scans,
Mm.
they've now authorized a series of studies called game film, where anyone that's ever played NBA, NFL, or NHL can come to Boone Hart, and now we're developing a number of centers around the country for a free CT angiogram. And again, it'll be
Wow.
good for them. We're already presenting some data at the American College of Cardiology meeting, but I think even doctors, it gets their attention when they see those three letters, NFL, NHL, NBA. You just want to read about it, and that could be very helpful in selling the idea. So oftentimes, though, it gets to the point where people think they've got to be rich or famous athletes to do what we do. Not
Hmm.
true at all. Ours is
Hmm.
really quite middle class priced and quite accessible to everybody if they really want it. But I think those interesting athletes are a lot of fun, and we've tested everybody from Tebow to Peyton Manning in the Broncos, just being players
Yeah.
that they screen. And now they've developed the combine at Indianapolis where they test all players for heart disease out of that Broncos experience.
Well, it blows my mind, and I think a lot of people feel this way, where you can have somebody who literally their life's work is to be healthy enough to compete at the highest level, and their heart, all of their organs are involved, but especially their heart. And if these things can unfortunately happen in these athletes who are being monitored, who are being very well taken care of, it is a fantastic, um, not a cautionary tale. How do I want to say this? It's just a fantastic motivator for us
Yes.
to say, what, this could be something that could help me as well. I can't throw a football 10 yards, let alone as far as Tim Tebow throws a football, but I can protect my heart the way that he's protecting his heart too. So I think it
Yes.
is, I think it's incredible. Dr. Boone, this has been an amazing conversation. And before we close, I did want to ask if the listener who is a pre-health student, let's talk to our pre-health student listener right now, wanted to explore preventive medicine, whether it's cardiology or anything else, what would you say to them? Where should they look? What should they be pursuing right now?
Yeah, it's interesting. A lot of the fun of medicine is learning these high-end skill sets. So
Right.
what I do is not for everyone. Even cardiologists, have learned all these techniques. And so you have to be very passionate about prevention
Mm-hmm.
to do what we do. Now, what's happened though is our ultrasounds, treadmills, echocardiograms, CT scans are now the highest level of technology. So, other than interventionally getting involved, there's a lot of high tech skill sets that could look at there
Mm-hmm.
as a possibility for their career. And then I think University of Colorado is pioneering the first physician assistant fellowship in preventive cardiology. So they've
Wow.
got so as a physician assistant nurse practitioner, you could actually develop almost a fellowship interest in this. So your profession has great opportunities there. We have patients or no, med students, fellows, others that rotate through and spend a month with us or sit in on consultations to kind of learn what we do because it is very unique. And then I think the other thing is remember the most important thing you've got is your brain.
Mm-hmm.
So a doctor, a healthcare trained person needs to always think outside the box, listen to the data. I'm always watching the data to eventually prove what I think is true. And that's pretty easy to be way ahead of the game. Um, you ever heard of the Swan-Ganz catheter?
Mm-hmm.
It's a
Mm-hmm.
cath. So long ago, I was at a lecture with Jeremy Swan. And
Oh,
some of those guys are so
cool.
famous, they don't have to show slides. They just talk wisdom. And it was interesting. He just said, now remember, all these trials are great, but it's your brain that's the best to filter that data. Don't rest on studies. Think outside the box. Now we also need to be protected from abnormal misuse of
Mm-hmm.
unproven things. But
Mm-hmm.
I think if you're
Mm-hmm.
following the data, there's usually 1,000 studies that have already been done before you get to the human trials of double-blind placebo-controlled trials. And you can tell if they're going the same direction, your wisdom is there. For example, ACE inhibitors.
Mm-hmm.
I had a nephrologist that if I'd have waited for the data, you could tell something was special about an ACE inhibitor. But if I'd have waited until they had all the proof, I'd have 500 more people on dialysis.
Right.
because you could tell that it was doing more. So that's the kind of cutting edge thought that I think young healthcare providers look at it, think about that. And then even simply back when I'm just a young pup, I'm thinking, how can you treat a disease if you don't measure it?
Hmm. Hmm.
And that started, with 30, 40 years of we got to measure it. How do you, risk factors aren't the disease, they're just numbers. My medicines, I didn't go to med school to use cheap medicines, bad medicines, just because insurance wants to use them. And
Yeah.
so I think outside the box in these things, and realize I do think that heart disease is psychiatry, lipidology, hypertensionology, rheumatology, cardiology, lipidology. The best person to be a preventive cardiologist is a primary care
Hmm.
provider.
Hmm.
And the cardiologist really should be in a role of just empowering that
Hmm.
because I want them to spend time learning how to throw a fourth quarter Hail Mary. And we're talking about the
Exactly.
preseason, and we
Wow.
need the whole country involved with that.
It's incredible, Dr. Boone. As our last question, as we wrap up, if we as patients and as clinicians truly embraced preventive medicine, what would healthcare look like, do you think, in 20 more years?
Well, I think you'd have an entire generation of 90-year-olds who haven't died. And
Hmm.
I think if you then, we just finished a book called A World Without Heart Attacks,
Hmm.
and the person who was helping us write it, um, she said, what great things could people do if they were dynamite from 65 to 95?
Right.
30
Right.
years of not just playing golf or recovering from strokes or heart attacks. So I think there's a lot of psychosocial things that could be great for society if people turn that on. Um, but it's still a tough world out there. And I just think that for the people that want it, you could eradicate these diseases. And then as a byproduct, your brain and your cancer prevention will go well as well. But yeah, to see how healthcare, it'll take the patient taking charge. We can't depend on the government or a system to pay for it. We've got to want to pay for it. And it's not going to be that expensive.
Hmm.
Don't buy another car if you got a lot of, go buy some better healthcare.
Yes.
Uh, and so you can enjoy it. One of the most fun things for me is the patients come in to hear about their latest escapades because they're young and healthy at 80 and they're not dying and they don't have anything to recover from.
Love
And
that.
they've got 19 grandchildren to play with and all that. So it'll be a strange world, but I always figure my job is not to figure out how to live your life. It's to make sure you can live it as long as is possible and not die of something you could have prevented.
Absolutely incredible. Dr. Jeffrey Boone of BooneHeart.com. Thank you so much for spending the time with us, for motivating us, and for giving us this amazing look into preventive cardiology. It is just incredible.
Thank you very much. Great to be with you. Great job.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company.